Hello everybody, I did my research paper on weight loss surgeries. So there are two kinds of weight loss surgeries. The first one is restrictive surgery. What this surgery does is it restricts the stomach in size, and this limits your calorie absorption. There are two kinds of restrictive surgeries for weight loss. The first one is called sleeve gastrectomy, and the second one is gastric banding. So gastric banding, what it is, it's they put a silicone band and they wrap it around the upper region of your stomach. And then there is they put a port under your abdominal area that attaches to the band, and saline is injected through this port. This makes the band inflate and constrict the stomach size. This makes a gastric pouch in the upper region of the stomach. This is a minimally invasive procedure, and it's also reversible. So it's through keyhole incisions, and they put a tube with a camera to put the bands around the stomach. Okay. This is just a picture. Right here you can, if you want to zoom in a little bit, right here you can see the band that's wrapped around the upper region of the stomach, and this is the line with the port that's right under your abdomen. Okay, it's before and after. There are risks of gastric bandings, like all surgeries. So the band can slip out of place, as well as the port. This may require additional surgery. Also, you can get gastritis, heartburn, ulcers. These are all common risks of gastric banding. The second restrictive surgery is called the sleeve gastrectomy. During this procedure, 80% of your stomach is removed. So what you're left with is a tube-like banana-shaped stomach. This also affects calorie absorption. With a smaller stomach, you'll want to eat less, which will help you lose weight. Nutrient absorption is not affected with this procedure. So the stomach is closed with staples right here. This is before and this is after. This is the portion of the stomach that is removed, and then this is what you're left with. That is sealed with staples, surgical staples. So the risk of this surgery is, of course, you can leak, your stomach can bleed from the staples. Also abdominal pain, fevers. So there are these hormones called ghrelin hormones. These are the hormones that make you feel hungry. Since your 80% of your stomach is removed, those hormones, there's less of those hormones as well, so you'll feel less hungry and your stomach will be smaller. Okay, so now we're going to talk about malabsorptive surgery. There's one kind, it's called Roux-en-Y gastric bypass. It's actually the most common one for weight loss surgeries. Malabsorptive surgeries, what it does is it bypasses the small intestines. This does affect nutrient absorption. Okay, so during Roux-en-Y, a small part of the stomach is separated, and part of the small intestine is bypassed. So this procedure is actually both restrictive and malabsorptive. So this is a picture right here. You want to zoom in a little bit. This is before, this is after. So the stomach is separated right here into a small little stomach called the gastric pouch, and then part of your small intestine called the jejunum is attached to this small pouch, so you could see where the major part of the stomach is bypassed. Okay, so there are risks of the Roux-en-Y surgery: blood clots, stomach leakage, diarrhea, cramping, heartburn, and of course during the surgery your neighboring organs are at risk too. And that's all. Thank you.